India accounted for nearly half of the world's reported COVID cases last week, according to the World Health Organization. The country's coronavirus deaths rose by a record 3,780 during the last 24 hours. The international community has been stepping up efforts to help India as the country suffers critical oxygen shortages amid this devastating surge in cases. Well, let me bring in Deval at this point. So you're working with a number of grassroots organizations, aren't you, Deval, through DASRA, really identifying where help is needed most. Tell us a little bit more about how that's going, because you described DASRA as providing last mile support. What do you mean by that?
Sure. And just to remind all our viewers of what's happening, I mean, we had over 3,700 deaths just yesterday in India. And that peak is just ridiculous, because the last peak we had in sort of September, October time was 1,200 deaths. So it just gives you a sense, and especially just hearing about what's happening in the UK and how successful the UK has been with just a small number of deaths that were talked about from the last segment with the statistician. I think this just gives us a sense of really where we're at. And to be honest with you, it is a war zone, except in this case, everyone who's dying are civilians. And so it's just absolute madness. It's taking days to find oxygen, to find hospital beds, to find ICU beds. Just our own organization, which only has 100 people, in the last 3 days, 3 of our colleagues have lost their mothers to COVID and have passed away. And so what we realized early on was we needed to work with local partners on the ground, because what's happening in Delhi, for example, is very different than what's happening in Bangalore. The same way what would happen in Bolton would be very different than what would be happening in London from a COVID perspective. And so finding these partners that have been in these communities for 15, 20 years, helping them identify whether it's diagnostic kits so they could at least see who has COVID and isolate those families in makeshift COVID wards. If they could even identify comorbidities to see who has heart problems, diabetes, and really see if those individuals within the community can take extra precautions. And like Amir said, many of these families, again, are not able to even leave the house, and they're working. Members of the household have COVID, and so money is not also flowing in. And so food, medications, just basic aid and cash transfers are so critical right now. And while the world has done a great job in bringing aid to India, you need people on the ground to actually help implement this aid. So getting concentrators into the country is great, but who's going to train the healthcare professionals to actually use them and getting to the communities that deserve it?
And some of the people I know, Deval, that you're reaching out to are in pretty marginalized communities. And if we look at people with resources in India who are struggling to get help for their loved ones, then you've got to only imagine the situation that people who are in more marginalized, impoverished communities are in to try to get help.
Exactly. And as a country, I think while, the foreign press has done a great job at highlighting the great tracks and strides India has made as a country in the last 2 decades, we still have 1 billion people that earn less than $5 to $10 a day. 1 billion people. And so those individuals, to your point, they live in one house, family of 5 or 6, which is 10 by 10 square feet. There is no possibility for them to social distance or isolate once one member of the family gets it. Our slums in Mumbai still, and across the country, many times 300 to 400 individuals are sharing one toilet. And so again, social distancing, something that is a privilege in the West, is just not a privilege in our country. And so while masks are being worn and people are trying to follow the rules, just the amount of poverty that we have and the need is so great that the same rules, again, that can be followed in the UK and the US are just not possible here.